Welcome to Binge Eating Breakthrough, the podcast to help you stop feeling out of control around food and build trust with your body. If you've tried everything but still feel stuck, you're not alone. I've been there too. I'm Jane Pilger, and I'm here to help you see binge eating in a new way so you can finally break free. Each week, you'll get the tools and insights to create peace with food and your body. Your breakthrough starts now. Hello, trusted listener. I am excited to talk to you today, really to continue our conversation from last week. So last week, we talked about on the podcast what a GLP-1 can't do for binge eating. And I told you last week, I am not an expert in GLP-1s. I do not want, that is just not my lane. And I do know that there may be plenty of you out there who are looking for somebody who is an expert in GLP-1 to get some answers that I am not qualified to give you. So I thought what we could do today on the podcast is bring in an expert. So today I'm excited to introduce you to Dr. Matthea Rentea. She is a board certified physician and an expert in GLP-1s. So thank you for joining us today, Matthea.
Thank you so much for having me.
Yeah. So really my goal for this episode is just to have a conversation about GLP-1 for anyone. So this may be somebody who is considering going on a GLP-1. Maybe they have some concerns. Maybe they're not sure. Should I, shouldn't I? Maybe somebody is on a GLP-1 and has some questions. Maybe somebody just knows, no, that's not for me, but I really don't understand GLP-1s. I don't really know what they are, what they do. My goal isn't for this to be a right or wrong, good or bad. It's really just to be an informative conversation with somebody who truly is an expert, because there is so much out there. I think it can be really challenging to just discern and figure out what do you listen to, who do you listen to, and why. So if you could maybe just start by telling us a little bit about yourself and your knowledge about GLPs, or how this kind of became your thing.
No, I love how you framed this, by the way, because there is no right or wrong, right? Like I'm not sitting here saying, oh, go on a medication. It's really about what's right for that person. So just a little bit about me. So I'm Dr. Matthea Rentea. I'm a board certified internal medicine and obesity medicine physician. And I started in primary care out of training. And so that means generally, because I'm internal medicine, that means 18 and over. And I had pretty complex patients because sometimes internal medicine, we get people that are a little bit more sick. And what I saw time and time again is that we would just be writing medications for things, but we could never really get down to what was actually at the bottom of things. And I wanted so hard to make the system work because I was in a little bit of an underserved area, and I really loved my patients and I wanted it to work. But what I realized is I couldn't get them the follow-up that they needed to be able to treat this metabolic condition. And so with time, a few years ago, I just said, okay, I have to go build my own clinic. If it existed, I would have joined it. But I started my own clinic. And part of it was that it was about more than just a medication. They needed to understand all these different areas, something that's really hard about, and I'm going to call it a disease. Okay. So when someone has a metabolic condition, that's the way that I look at it. Some people might not look at it in that way, but I do think that there's insulin resistance at play and a lot of things like that. And when you look at this, it affects every single area of someone's life. And so you can't just like give one medication and they're on their way. People that come into my clinic, I see them monthly. I've seen them for years, and majority of them, they don't leave because they're getting the support that they need to understand what's going on with everything. And so partly it was to help patients, but then also I myself have this as a challenge. And I realized how hard it was for myself to get the help, for myself to get the knowledge, right? And so I wanted to make it easier for people to be able to understand what everything meant and how to look at it.
Nice. That's awesome. So tell me this, if for the person who really doesn't know much about GLP-1, okay, I know they're out there. I know a lot of people are on them, but tell us just kind of in a quick summary, what exactly does a GLP-1 do?
So the first thing that we need to look at is GLP-1s, they've been around for over 20 years, and initially they were used for blood sugar management. So that's diabetes. And then what we saw when we were using the medications is that people also lost weight. And what's happened, unfortunately, is that now people assume GLP-1 equals a weight loss medication. And
Mm.
it's not about weight loss. It's really about your metabolic health improving. And so the first thing that we just all need to know and establish is that either overweight or obesity is actually not a behavioral condition. It's not something where you're picking to do these things. It is a physiology that is not working properly that causes there to be problems. And so one of the things that GLP-1s do is they do a few things in our body to help with our metabolic health. So it might go to the brain centrally to help your appetite centers. And so it's not that you now are not hungry and you don't eat, but you might have been overly hungry because hormones were not regulated properly. So I'll give you an example. Your insulin levels are up, so you're more hungry, but you're leptin resistant, so you're not getting the satisfied message. So that's a hormonal problem. And then the GLP-1s are helping to treat that. And then you might have high hunger levels because your ghrelin is through the roof. That's the hunger hormone that says you're hungry, start eating. Okay, that's not going to get solved by a nice big meal of fiber and protein, right? It's like, oh, drink more water, eat more fiber and protein. The GLP-1 is going to help you to be satisfied with the appropriate amount of nutrition that you need. So that's just an example that we're helping treat actual disease that is occurring in the body. And if you didn't need it, it wouldn't be effective. That's a big thing to really look at.
Got it. Okay. So tell me this, if somebody is struggling with food, maybe they feel out of control around food, maybe there is binge eating, there is this sense of challenge, real challenge around food, and they're trying to consider, is a GLP-1 something that I might want to consider? What should someone know, or what should they think about before starting a GLP-1?
So the first thing that I would look at is that a GLP-1 is not going to solve everything. It's not like you're going to get on it and suddenly like the birds are singing and everything is solved. So there will still be the aspect where you need to look at if there's anything emotionally that's driving things. Is there anything from a nutrition standpoint, like you are under eating, right? You're constantly trying to starve yourself and you're wondering why these binging episodes are coming, right? Or there might be your work is too stressful. And so that stress is driving things, or you're sleep deprived because you entered menopause and now hormones are off. So you still need to look at what is actually driving this process. But there comes a time when you've actually done all those things. You're aware of your sleep. You're working on stress. You are walking every day. You are doing all these things and you're still struggling. That's the time when I think that it's appropriate to look at, do I need another tool? And the problem is that we've associated needing a medication with shame because
Mm.
we've been told for years and years, well, you should just be able to work harder. I'm like the first guilty one of this. And it's funny, I'm even ashamed to say that because I'm a clinician that was using these, but in my mind, I kept thinking I need to work harder. You're not doing enough. And at one point, I, for years, had been doing intensive coaching and working with nutrition people, like all the things. And I told my friends, we were at a retreat, and I said to them, one is a physician and one wasn't. And I said, but I just need to work harder. Like there's still times when I'm not eating perfect. And my friend that's a physician, she looked at me, she said, Matthea, get on the medication. You for years have been working on this. Like it was not for lack of trying or effort or resources or money, right? I was ordering the meal services because I was busy. I was trying to then make it myself. Like there was no stone unturned. And so that was the time when I was like, okay, I need this additional tool. So it is one tool to help the metabolic process that's occurring.
Got it. Okay. Super helpful. So let's talk about the shame that a lot of people have around it. How do you help people work with the shame that might come up in what they might be thinking about their need for a GLP-1?
So it's hard because it's coming at you from all areas of society. I think the first thing that I have people look at is, where is the shame coming from? So there's some type of a voice in your head. There's like a dialogue running, right? And you picked that up from someone. So it might have been a family member saying, you really need to exercise more. It might have been a doctor that said, eat less, move more. You got the messaging somewhere from a magazine. So you have to identify, where did that actually come from? And do I want to keep holding on to that? Because that's really important that you start to get to the place of, I'm going to make these decisions and I'm going to decide on my own and not from external voices. The problem is that you're hearing those external things like 24/7. So you need to daily, usually I find for people for usually a year or two, we daily need to be like, why am I doing this work? What do I want it to mean? What's important to me? What would success look like? You look at all that and you stop focusing on what someone in the media is saying or what a friend or a colleague. You really need to focus on your own lane for a good amount of time to a little bit get strong because society is constantly trying to break you down with diet culture.
Totally. So tell me this, who should not be on a GLP-1?
So people that don't need it for treating a condition. So I think what's horrible is that when we entered the pandemic, they became very popular in the
Yeah.
celebrity culture. And what was very clear, very quick, is that they were not using it for health purposes. They were using it to lose a 10, 20 pounds that they didn't even need to lose to begin with. It was very much so to get this ultra thin appearance, right? This thin currency of, okay, if I'm thinner, then, I get more jobs or whatever it might be. So if you don't need it medically, that would be the first person. The other person is if you have let's say binge eating disorder that's very out of control, like you maybe multiple times a day you're binging, things like that. These medications can help, but if you are not pairing it with additional support, it might hurt you more than help you. So for example, I have patients, if their binge eating disorder is really out of control, they on the medications might feel even more sick because they're still engaging in those same behaviors. But now we have this, I call it forced learning, but now you have these really negative consequences in addition to already feeling bad and already the shame. Now we put a whole extra layer of nausea and maybe vomiting, and actually your health might get worse.
Mm.
So I say this cautiously because it can help treat, but you need the correct support. So someone that doesn't need it's detrimental, but you could potentially need it, but you need the right supports as well. So if you don't have the right support, sometimes I think you're better off not going on a medication than taking it haphazardly and having no guidance. You might end up in a much worse place. And if you've never done anything to begin with.
Yeah, so let's talk about that a little bit in terms of going on a GLP-1. Let's say you just go to your doctor or you just find something online, right, where you get the medication, but you aren't really getting the support, like you said, the support to go alongside with it. What let's talk a little bit about, kind of the challenges there.
So here's what's going to happen. Initially, you're going to love it because you're going to go on it. Your appetite's going to go down. You're going to lose weight. You're gonna be like, woo, okay, this is amazing. The problem is long term, it's not going to work out for you. So I want to paint a picture. Everyone that I've ever worked with cares about weight regain. That's one of their main fears that no matter what size they are, persists. And if you long term do not want to have weight regain, do not want to be cycling, do not want to have falls off, just fragility where you are, you fall down and you break a hip and now you can't walk for months on end. If you want to prevent all of that, you need to care about what you're doing when you start these medications. And it's not hard, but there is some attention. So the protein that you're eating, you need it as a building block to keep your muscle. And that's not just about metabolism staying high. The muscle is about 70% of your daily energy expenditure. It's coming from that. So if you don't maintain the muscle, you suddenly have to eat lower and lower calorie and it becomes unrealistic. It's not sustainable at some point. So the engine matters. It matters from a fragility standpoint. You late into your age, you can still do things. And that's why we want a good health span, not just that you have, a few years when you're younger. I want you into 80, 90 years old for life to still look good. So the protein matters. The fiber matters, not only from not getting constipated and feeling bad, but from a GI health standpoint, we have millions and billions of bacteria in the gut, and they need fiber to be able to work properly and for you to not get cancer. There's so many benefits to all this. Hydration matters. We're made of a lot of water. You need to get that in. Pretty much everyone's dehydrated. Like I'm gonna put it out there. And then movement, again, it's not about a weight set point. It's about if you're not moving your body, you don't maintain your muscle, your vessels start to get clogged. You don't have the exercise endurance. Your heart needs to work in the same way that your leg muscles and other things do. So all of that together, if you are getting at least 10 minutes of strength training 3 times a week, maybe a 30-minute walk most days if you can, you're getting your protein and fiber, and you're caring about sleep and stress, if you're doing some of those things, not even every day perfectly, but more days than not, you're trying to roughly hit some fiber, roughly hit that protein, you're probably going to do really great. You don't need to be perfect.
Awesome. Super helpful. And I think it's so great to really be thinking about this isn't just short term. This isn't just what I want. I want this result. I want this, weight loss or whatever it is. But what is the longer term and what does that look like? So tell me this. What are some potential side effects, complications, maybe reasons somebody might choose not to be on it or choose not to stay on one?
Yeah. So there's a few big contraindications where if you have this, you can't go on it. So that
Okay.
would be something like if you have a history of pancreatitis and we don't know the reason for it. So if that's a reason, or you have a history, either yourself or family members, of medullary thyroid cancer. And that goes in a very specific syndrome of categories. If you have that, that's not the normal type of thyroid cancer that occurs very often. This is actually very rare. Or if you have a history of something called gastroparesis, meaning the stomach does not contract normally. So food really stays in there and you actually feel very nauseous and sick as is. So if you have that, we're never even going to start the medication. But if we start the medicine, I'm going to go through the side effects, but know a lot of these things, if you are working with someone and you're adjusting things, the goal is not to have side effects and that's how you're working on your health. It's we actually can manage these things. So I think the top thing would be nausea. And the reason being that food's staying in the stomach longer. It's actually moving through the intestine slower. And so if you're still eating the same portion or you're not aware of the macronutrient distribution, meaning let's say you eat a really fatty meal or only carbohydrates, like if meals are not balanced, your nausea can be high. If you're eating too much, too often, nausea can be up. So that's the first thing. So that's solved by maybe smaller meals more often, really looking at, again, what are the ratio of my meals? Basically, every meal you need to have a protein, a fiber, and a carb. So can we start to balance the carb, the fat, the protein in every meal? The other big thing is constipation, because again, like food's sitting in there longer. And so fiber, hydration, and movement are your friend. So just in general, roughly women, we want at least 25 grams per day and men 38 grams per day. Now that's pretty high for the average person. If you've not already been eating a really whole foods diet. So a lot of people, they're eating up to 70% ultra processed food, means it's in a package or it's processed in some way. If you're not already eating whole apples and beans and, things like that, slowly work to that. So I say you don't go, you figure out where your baseline is for fiber. So do a nutrition log 2-3 days. And we're not trying to figure out calories. That's not the point. It's to figure out how many grams of fiber on average you're getting. The typical patient that's coming in to see me is getting anywhere from 10 to 15 grams per day. So to get up to 25 grams, that might take you a year to work up to that. So not more than 5-gram increase for that week for a month. You figure out, am I no increased gas? No, not feeling bad, right? So you slowly work to increase fiber. My goal is always get one more fiber source per day. So for example, you say, okay, I'm going to get half an avocado because I know that a full avocado has 10 grams. Half of it's going to be 5. Awesome. If I add that half an avocado, I do that daily for a week. I see how do I feel. We don't suddenly go higher. Otherwise, you actually feel worse. And then the other thing with constipation, so it's not just fiber, it's hydration. If you're not hydrating, again, the gut does not do well. And then movement also naturally moves things along in the gut. I say if you're not moving, I don't know how people manage in general. If you're not walking or doing something, it is incredibly uncomfortable. If you're getting enough fiber and if you're doing these things, you've got to move in some capacity. So usually if people are doing those 3, we don't need to rely on other supplements or over the counter thing or prescription medication to manage that. So those are the 2 most common ones. You should not be vomiting. That means something massively is wrong. There should not be other massive things occurring. If it is, you really need to talk to your team, but nausea and constipation are usually the top 2.
Mhm. Got it. Got it. So tell me this, when it comes to the impact of the GLP-1 of appetite suppression, not being as hungry, how does that impact somebody who already has a complicated relationship with food, can that make it harder for some people, or what does that tend to look like?
Yeah, it depends on the person. So a lot of the time, it's not just that appetite goes down, also the desire for the type of food can change. So it can actually happen in a very advantageous way. So for example, again, I'll just always give my own example, but I see this with patients too. So in the past, before I had treatment, it would be, I want Sour Patch Kids, I want Pringles, like it was, salty, sweet, crunchy, like that was always what I was wanting. And then when I got on the medication, I was able to eat the apple and be okay. I actually wanted a salad, right? So sometimes you now have the desire for the things that serve your body a little bit more. That's an amazing lane if we can be in it. Okay. That's what we want to go for. But sometimes what occurs, and this is where it's troublesome, if you were brought up on believing that restriction is the only way. So you think I have to cut out whole food groups. I need to eat, this low calorie number, right? You're coming up with this stuff. The problem is that you will then double down on that and you get rewarded because the weight goes down or you think you're going in the direction you want. You're not looking at body composition, meaning how's my fat or muscle changing. You're just like, the scale's down, amazing. So you get very encouraged by that. And then you keep going more and more into restriction and not eating. And eventually it will blow up. Eventually it will be a problem, but you don't know that potentially for 6 months to a year. You'll figure it out, but it's just really sad because it'll occur in a way where suddenly now your muscle's down, now you're getting sick, now you're low energy, right? All these things will happen. So when you head into this, the goal is really, what am I working toward? Am I working toward nutrition improving, me being more strong? That is what matters, not just that I don't eat, that I don't have this or that. That's not the point. It's what are you going toward that really matters.
So, what are some of the warning signs if you are on a GLP-1 and you are, maybe you don't even realize it, but you're on that trend of 6 months or a year from now, we may have a problem? What are some of the little things that somebody might be able to kind of see as oh, maybe I need to look at this?
So I think there's both data that you can look at and then
Yep.
how you're feeling. So
Okay.
let's talk first about how you're feeling. If you are feeling low energy and it's hard to do the things you want to do, and I'm not even talking only from a like physical, like it's hard to get up and to do things, or a big warning sign for me is, let's say that you're working out and you normally do 30 minutes a day and you suddenly by that 15-minute mark, like you cannot push through. And we even try some applesauce before, we try some things before the workout, right? Like maybe you weren't eating and now we need to. That's a red flag because that means the nutrition that we're giving you cannot fuel appropriately the workouts that you want to do. So I think energy is a really big deal. The other thing is sleep. So sometimes people are eating so little, they kind of become, I'm going to use the term like ketogenic. So they're eating so low carb that creates like a vigilance in people. And sometimes sleep is affected. And
Mhm.
literally, if we just give them a little bit more carbohydrates, they're going to do just fine. Right. So your energy and your sleep and your mood are things that you should be tracking. And if that is suffering, it's not worth it, right? Like we need to adjust things or the medication's not for you. So that's from a how you're feeling standpoint. And then from a data standpoint, generally accepted within my community is if you are losing more than 1% total body weight per week, it's usually too fast. Like the body cannot only release fat during that and just hold on to muscle. So that's a good measure that you can look at week after week. And then within a month, is it not over 4%? That's one thing. And the second thing that I think matters much more than that is, what's your rate of skeletal muscle loss? In my world, because I'm not pushing speed, because I'm so obsessed with nutrition and just like very holistically how everything's looking, my average patient is not ever losing more than 5%, if not zero, of their muscle. And so, but if you look at the studies, it's up to 40% skeletal muscle loss. And when you think about how hard it is to gain muscle, let's say that you get to your goal weight, okay, and you lost 20 pounds of muscle. And you're like, no problem. I'm just now at my goal weight. I'm going to work to gain it, right? A woman that is doing things perfectly with protein and exercise and sleep and all the things that she can gain muscle, right? Like everything's working perfectly. Maybe she can put on half a pound per month. Maybe within that year, she can put on 6 pounds of muscle if she's not only doing all the right things, plus genetically blessed. For all of that to occur, it's really hard. So you are so much in a better position to when you're working on this to care about this stuff versus on the back end to have to remediate it. It is so much harder. I actually have a lot of people that come in already at maintenance into my clinic and they want help to not regain it, or they realize that they didn't do it in the best way. I had someone come in, they had lost 17 pounds of muscle, and I have to tell you, her road is a lot harder than if she had
Mhm.
started with me and none of that had occurred. And I get that life is life and you find the information when you find it, but those are really so the way you can do that, you look at where's my muscle at right now and over where I started, and you see what percentage that is. And if it's over 10%, I think it's a red flag. I think that's a very realistic number because I either need to slow things down or I need to increase protein, or maybe I haven't been strength training. And often people can kind of get away with it to a point. Let's say that you start the first few months, you're fine, you're keeping all your muscle. There will be an off the cliff moment. So there is a point with your body composition, meaning pounds of fat and muscle, where the body doesn't have this massive warehouse from fat to get from. So think about like a literally like a warehouse. Okay. So initially it's like, great, we're taking fat out, we're taking fat out. And then it gets to the point where there's very few boxes in that warehouse. And your body's like, well, I don't know. Is that a fat box or is that a muscle box? It doesn't know. It needs energy. It needs to pull from something. And if you're not tracking monthly what that body composition's doing, you will not know what's happening with the muscle and when that point is. And that often dictates maintenance as well, because oh, my body doesn't like to be under this. It means I'm losing 50% muscle. So monthly looking at what's happening, it's really going to help you to adjust things as needed instead of a year later, things are in a direction you don't want to be. You can just slowly correct things instead of these wretched shifts where all of life needs to change. It's not sustainable.
Oh, okay. Amazing. Super helpful. So let's talk about this. Is a GLP-1 meant to be a short-term tool or a long-term treatment? And how should one think about that decision?
So for about 99% of people, it'll be a long-term treatment. There are exceptions. So let's talk about a few of those exceptions. If you never for very long to begin with metabolically had a problem, you're not going to need it long-term. So I'll give you an example. Let's say that they had a depressive episode for a few months and they gained 50 pounds, but normally they had no insulin resistance. They had no problem. It was just completely that happened for a few months and then they get appropriate treatment for that. They're feeling okay. If they go on a GLP-1 for a few months, a year, things like that, they get back to where they were to start. They were not for 10, 20, 30, 40 years with metabolic disease, right? So I use the term, they're very metabolically flexible. So they'll be able to lose the weight and they're just fine. And also those are typically the people that can lose that fat very quickly. So it's the friend where they lost 20 pounds in a month and they have no problem. You just have to eat better. Okay. They never had disease to begin with. So one of the problems is the more sick you are, the harder it is to work on. So this is the hard part because you assume, okay, if you have over 100 pounds to lose, that it should be easier. It's the opposite. It's actually harder. That's why it's so hard here in America that we make people get so sick in order to qualify for treatment. So if you were not sick very long to begin with, maybe also, let's say sometimes women with pregnancy might put on more weight than they want. They have a hard time losing it right after. Again, that's someone that might not long-term need it. But most people, at least that are coming into my world, they have struggled for decades with this. Maybe even as a child, it started to be a problem. And that's not going anywhere, that disease. That insulin, I just always come to insulin resistance. It's the easiest one to explain. That is driving this process. It is driving your hormones. It is driving how you think about food. It is driving everything. Your body might respond differently to exercise. And so if we then get you to your goal and remove the tool, it makes no sense. It was one of the legs of the table that helped you to accomplish this, right? And so when people say, oh, when you remove the medicine, people regain the weight. Yeah, it's like if you had blood pressure, we gave you a med, or a thyroid problem. If we then removed that when we got it into the range that we want, you would go right back to where you were to begin with. So for most people, it really is a long-term tool. And that's why it's really important before you go on the medicine to have some conversations about that, because can you have access to it long-term? Are you willing to stick with this long-term? These are actually very important things that need to be discussed early.
Wow. So powerful because I mean, again, I am not an expert and I'm not involved in a lot of conversations around them, but the conversations that I am involved in, it does seem like there's a very common kind of either, well, I'll just go on it for a little bit, or just kind of this idea that it can almost be used as a short-term solution for somebody
Not
with a
only
longer term. Yeah.
totally the one phrase that I actually discharged someone from my clinic, they were really looking for like a jump start, quote unquote. And to
Yes.
me, I was like, red flag, you are not in a space mentally or in your life at the moment where this is actually going to be a change for life for you. And I'm not saying that everyone has to stay on the medication for life, but even just this concept of like, I'm going to take this to start the engine to like quickly get the result I want. What's going to happen after that? How it begins is how it's going to end. So if you're not already coming at this from a perspective of, I want to figure this out for life, like for life, you're going to have to adjust things. It's not just a few weeks or months. I care about you 10 years down the road.
Yeah. Yeah. Absolutely. Absolutely. Okay. So tell me this. So let's talk bigger picture about a few things. What in just in case there's something we haven't touched on yet. I'm sure there's so many things we haven't touched on, but what do you wish more people understood about who these medications are and aren't appropriate for?
So I think what's tough to answer about that is that everybody's individual with their health and their life and just how everything looks. And so what I wish more people knew is how to appropriately vet the medical team that you're working with. And I
Mm,
think one of the easiest and hardest things at the same time to do is to go into that visit and you say, what is your understanding of GLP-1 medications or what's currently happening with these medicines? And what you want to hear is, do they view this as something where they're going to look at you as a person and what's happening for you individually and what would be best for you? Or do they already have a bias where they think that, oh, these medications won't help you, or they're not willing to have the conversation about the pros and cons? That is the thing that should concern you the most. And also, you didn't ask it, but I need to go here.
please.
If you have a medical team that is already biased against you because of your weight, they are going to miss medical conditions because they're going to blame everything on your weight. And unfortunately, it gives me chills. It's really sad to see how many things get missed when someone has the condition of obesity because everything's blamed on it. The appropriate workup isn't done and it's devastating. And so you need someone who says, okay, this is one thing that's going on, but it's not defining you, right? Like this is one thing in the same way that blood pressure or anything else could be going on.
And I would imagine it's pretty clear if your medical team is already biased against you because of that or not.
But people don't trust themselves, right? Because their
Mm,
whole life, and I know this, like when
yeah.
I would go into the doctor, it's this wretched feeling when you can just tell the way they're looking at you or what they're saying. And we didn't know before that we could be like, you're not the person for me. I'm going to go seek someone else out. And I know it's a lot of work. Anyone who's listening, I know how hard it is to find a doctor or for them to stick around, right? Because they leave in the same way that I left. But this is work worth doing because you won't listen to them. You won't respect what they're saying. You will not achieve what you need to achieve with your health if your team is sabotaging you. And so your gut feeling matters, and you need to learn to start to trust that you're not crazy for what you're feeling.
You know, it's what is coming to mind right now as we're having this conversation is the number. I mean, I can think of, I'm just seeing conversations, I'm seeing faces of clients in my mind right now of so many conversations that I've had with people who, when they're, it may be an annual visit, it may be there's some sort of doctor's visit that's coming, the amount of concern, the amount of worry, the amount of what is the doctor going to say to me?
Yep.
This is what they said last time. What are they going to do? The amount of canceled, postponed appointments, those types of things. It's so if you are listening and you have the experience of, oh, I hate going to my doctor, or I don't go, or I put it off, or I'm so worried about what the doctor's going to say. One, I want you to know you're not alone in this. It is, I think people don't realize how common it is because we keep these things to ourselves. But also, yeah, what else do you want to say about that?
First of all, it's a nervous system response. Like it
Yes.
is, I want to go as far as to say not big trauma, but it is trauma that you've experienced. And so this is you can cognitively in your mind know, okay, well, now I know this, or I'm empowered with this information, but it doesn't change the physical realities that your body's experiencing. So this is something I know where you do such great work with people, and that's really needed. But I want to say two things with this because everyone is going to experience this. So number one, when you go in there, you can choose to educate and to say, hey, listen, we don't talk about people's body anymore in this way, or here's what I've learned, right? Like you can do all the educating. I have some people where they actually recommend that the doctor listens to my podcast and then they'll go back to the next visit and they're like, oh, I didn't know, da, 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 right? So you can do that. But I want to say that's actually very emotionally expensive for you to go in there and educate and advocate. And often we are in freeze response in these situations. I experience this. Like I cry at the doctors. Like I'm not medical Matthea when I'm going in there. So know that if that's occurring to you, that again, that's a sign that that person is not the right person for you. But know that if you sit there and you talk to them and they're willing to have a conversation, they can change. Some people, the next visit will say, you know what, I learned this or that, or I didn't realize XYZ. So if they're willing to learn with you and change and say, oh, I didn't know that about you, or, whatever's happening, I know I've made so many mistakes in treating people, and I mean we're learning all the time how to talk to people and what to do better. So there's a clinical team that's willing to learn and sees it as a problem and wants to change, and then there's where it's actually really bad energy coming at you, and there's lots of stigma and bias, and that's what we're not going to accept. That's the thing that we need to remove.
Yeah, absolutely. Yeah. So important. So important. So tell me this, what is a question that you rarely get asked that you wish more patients would bring into this conversation?
The biggest thing would be not what can help at this moment or how quickly I can do it, but what do you think long term would work best for me? So here would be the question. What do you think in 5 years from now, if I start doing these things, will lead to the best health for me?
Mhm.
Not weight loss, not shape shifting, but how do you think, given what's going on for me right now, in 5 years, I could have the best health if I were to start to do these things? I think that would make a world of difference for people.
Amazing. So you mentioned your podcast and there is so much information out there. So what is your recommendation in terms of if somebody has listened to this conversation and they're like, wow, okay, maybe this is something I want to look into more. Maybe I'm already on a GLP-1, but I can see I'm kind of maybe I'm not looking at my muscle. Maybe I'm really worried about what could happen 1 year, 5 years down the road. Maybe I have been looking at this as kind of like a jump start or something short term. Where can somebody go to get more information that they can trust?
I think a really good place would be to start with my podcast. It's the Obesity Guide with Matthea Rentea, MD. And we've done something really cool where we have a free podcast roadmap. So I have hundreds of episodes at this point. I've been podcasting for years. And so if you go to renteaclinic.com/podcast roadmap, we have a free guide where, let's say you want to learn about a medication. We have a category of medications and you could pick the name of what you're on, or you want to learn about, hey, what are the best ways to get protein or the best ways to get fiber? I make episodes that are quick, that are easy, but that also are practically inspirational. And so it's not ever really a knowledge problem because a lot of you have heard great things and you know what to do. You need to connect the dots in a realistic way where habit transformation can actually occur. And so I really do that on my podcast. So I think that roadmap has been one of the most popular things because people find exactly what they're looking for in a way that's not complicated.
Yes. Okay. So we'll make sure there is a link. We have a link to that in the show notes. So that will be available. Anything else that I haven't asked you? Anything else that you think would be important to discuss?
I think the main thing I really want to stress if someone's listening is that you did not pick this. This is not something where you are choosing to have this as a health problem. And I think, again, we've been just told again and again, well, if you stop doing this and you start doing that, I want you to know that this is not a choice. This is an actual disease process potentially that's happening for you, and that there are answers for that. It's not a willpower problem.
Hmm. So powerful. So powerful. Amazing. Thank you. I will make sure that your link to your podcast, to your website, if anybody wants to get more information, that is included. And just thank you for having the discussion. And I certainly learned some new things today too. So I'm sure that anybody else did as well. So that's what I have for you this week. See you next time. If you like what you're hearing on the podcast, you will love my new book, The Binge Eating Breakthrough: Why Food Isn't the Problem and What Really Is. Discover why willpower isn't the answer, why restricting certain foods often backfires, and why understanding your brain and body is the key to lasting change. Learn to shift from shame and self-blame to curiosity and compassion. Get it today at janepilger.com/book.